Parasitology paper discussion. A 10-year-old schoolboy presented with watery diarrhea and abdominal cramp. A feces specimen of this boy was examined microscopically and pear-shaped flagellated structure moving like falling leaves were observed. So from this information we have to find out the parasites and we have to give the answers for these questions, right? The questions are: what is the possible parasite causing this condition? Write another name for this parasite. Draw a descriptive diagram of the flagellated structure that could be seen. List out the available method to diagnose this parasite, and what is the infective stage of this parasite. Describe the mode of transmission of this parasitic infection. List out the available method to prevent these parasites. From provided information, there are 4 clues or evidences are there. One is the specimen that was submitted, stool sample. Other one is the age group, the age is 10. Other one is the third evidence is the watery diarrhea and abdominal cramp. Fourth evidence is morphology in microscopically. It was pear-shaped flagellated structure moving like falling leaves. By using the first evidence, we can exclude some parasite and include some parasite. The first evidence is the specimen. It is the feces sample. So by using this we can exclude all the blood parasite like Plasmodium species, tissue nematodes, Leishmania species, Trypanosoma species and Toxoplasma species. So only we can here include all possible parasites are all intestinal amoebae, intestinal flagellate, ciliates, intestinal nematodes, cestode and the intestinal trematodes. By using second evidence for the intestinal parasite, most common groups are affected. Children are the most effective groups. So here the possible parasites are almost all intestinal parasites. So up to now we all know there are 6 parasites are possible: amoebae, intestinal flagellates, ciliates and intestinal nematode, cestode and intestinal trematode. So when we look at the third evidence, is watery diarrhea and abdominal cramps. The most of the intestinal parasites cause abdominal cramps. So by using the abdominal cramp, we cannot conclude or we cannot get any idea about the parasites. Here the parasite cause only watery diarrhea. The evidence tree indicate that only these parasite produce watery diarrhea. So by using this point we can exclude when we consider the intestinal amoebae. Pathogenic amoebae cause sign and symptoms. So here the other non-pathogenic amoebae we can exclude. So here only one amoebae remaining, that is Entamoeba histotica, but which cause blood and mucus watery diarrhea. So we can exclude because these parasite they produce watery diarrhea only. There is no blood or mucus. When we consider intestinal flagellate, example Giardia lamblia, it causes watery diarrhea and abdominal cramps. So there is a possibilities of Giardia lamblia as this parasite. When we consider ciliates, example Balancherium coli, here also they produce, that means Balancherium coli produce blood and mucus watery diarrhea. So we can exclude. Up to now, possible parasite is intestinal flagellate. Intestinal nematode. Normally intestinal nematode produce watery diarrhea and abdominal cramp, and also they produce some clinically specific condition also. When we consider the trichuria, it's produce dysentery syndrome, that means they produce blood and mucus diarrhea. Enterobius vermicularis, they produce cardinal symptoms, that means the female adult worm migrate from colon to perianal area in night time. Hookworm, epigastric pain and inflammatory diarrhea. Same time, they produce iron deficiency anemia and protein energy malnutrition, also the significant clinical features. Strongyloid, it's produce colitis and malabsorption, and same time the larval stage migrate to other part of the body and produce uh, other symptoms in other part of the body like CNS, liver, kidney. Ascaris species, they produce pulmonary symptoms and eosinophilic pneumonia. And same time, chronic malnutrition and the growth retardation also we can observe in children's. Toxocara, they produce hepatomegaly and the ocular larval migration. When we consider the chest root, Taenia solium and Taenia saginata, they produce mild abdominal pain or discomfort, nausea and loss of appetitis, headache, and sometimes they produce changes in bowel habit, that means constipation or diarrhea. When we consider the Echinococcus granulosus, most common site of the location, that means most common site affected by these parasites is liver or lung. It's lead to palpable abdominal mass and hepatomegaly. Palpable abdominal mass means the swelling of abdomen. Hymelopis diminuta and Hymelopis nana, abdominal pain, headache, and they produce diarrhea. When we consider the intestinal trematode of frogs, Cystosoma menzoni, it's produce inflammatory reaction and it's lead to granuloma formation. Here there is no any evidence of watery diarrhea, so we can exclude. Cystosoma japonicum also mucosal hyperplasia, ulcer, and same like Cystosoma menzoni, inflammatory reaction, it's lead to granuloma formation, so we can exclude these parasites also. When we consider Phaseolopsis boscae, here it's produce malabsorption and protein loss enteropathy, and the other evidence is it's produce yellowish green stools, so uh, there is no possibility of Phaseolopsis species. So from evidence number 3 we can conclude only two possible parasite, intestinal flagellate and intestinal nematodes. We can exclude other parasite due to some specific conditions like blood and mucus, or sometimes produce enlarged liver, or sometimes produce iron deficiency anemia, so we can exclude. Evidence number 4 is the most important part, morphology in microscopically. It's appear pear-shaped flagellated structure moving like falling leaf appearance. So we already discussed by using evidence 1, 2, 3. So finally we get only two parasites, that means parasitical species in intestinal flagellate and intestinal nematodes. According to the morphology, it conforms intestinal flagellate, Giardia lamblia. Now we identify the parasite by using the evidences. So we go to the questions. What is the possible parasite causing this condition? Answer is Giardia lamblia. Right, another name for this parasite. This parasite we can call other two names. One is Giardia intestinalis, other one is Giardia duodenalis. Draw a descriptive diagram of the flagellated structure that could be seen. Here you have to draw the flagellated structure and you have to describe the morphology and specific characteristic of this structure. So when you are drawing, you have to consider the shape of the parasite. It is pear shape or teardrop shape, and anterior part is the rounded, posterior part is the pointed. Size is about 12 to 15 micrometer long and 5 to 9 micrometer wide. The dorsal surface is convex, ventral surface is concave. Ventral surface, when we consider it, we can see the parasucking disc. It is occupy half of the body and it is laterally symmetrical. That means when you are cutting laterally, you can get two similar pieces. And when we consider the sucking disc, inside we can see the nucleus, small nucleus at the center of each sucking disc, and inside the nucleus we can see small karyosome, and here we can see four pairs of flagella. One pair, that means two flagella from anterior, arise from anterior. Two pairs of four flagella arise from laterally, and two or one pair of flagella present in posterior or caudal area. And we can see median body or exostyle, and we can see the cytoplasm. These are the things you have to consider when you are drawing of this flagellated structure. List out the available method to diagnose this parasite. Stool examination. By using these, we can detect the cyst and trophozoite by preparing wet mount saline and iodine. Concentration technique: when the stool sample is the contain low amount of parasitical stages, that time we go for the concentration technique, so it concentrate the parasitical stages we can easily observe. Entero test: antigen detection in stool by using ELISA and ICT. Antibody detection in serum, ELISA and IFA. Culture technique: molecular method by using PCR. Radiological finding by using X-ray. What is the infective stage of this parasite? Polynucleated mature cyst is the infective form of this parasite. Describe the mode of transmission of this parasitic infection. Men get this infection by ingestion of food and water contaminated with mature cyst, and sometimes rarely by sexual route, mainly homosexual. List out the available method to prevent this parasite. First, improve the foods. That means thoroughly wash the raw foods, fruits, vegetables when we take raw, right? And boiling or filtering of potentially contaminated water. Treatment of asymptomatic carriers: thoroughly wash the hands with soap after toilet. Avoid night soiling. That means night soiling means avoid the feces as a fertilizer. Health education, personal hygiene. Thank you.